fridge
I know.
We're at Allison's house.
Yes.
Because we want to make sure that...
Because my house is possessed by ghosts. Yes. And so we wanted to come here to make sure that we could go live in an effective way for you guys. Just so you know, I'm Dr. Katie Friedman. I'm a board certified pediatrician, along with my sister Allison and my twin sister, Carrie.
Wow. You don't even know who I am. I'm her little sister, Carrie. We just met. So.
And my twin sister Allison, we run a parenting blog called Forever Freckled. And during the pandemic, we've done a lot of research about COVID-19. Just to give you guys a background, I am a pediatrician. I work in the emergency room setting. So I have become COVID expert pretty much, you know? So, and we have seen some changes over the last few weeks that we've been talking about on our platforms. I've actually done an amazing live with Tales of an Educated Debutante. And so we've had a lot of people, new followers, new families coming for education. And we've gotten a ton of questions through Facebook and Instagram, a ton. None that I can DM all, like it would take me forever to DM everybody back. But it's so important for me that you guys feel educated and rooted in information and what you need to know. So what we did is we took the most common questions that we got and we decided just to hop on a live and answer all your questions so that you can then share this, save it, give it to somebody else that is asking the same questions, because typically a lot of people do have similar questions. And so we hope to address a lot of those here and just kind of ease some fears and talk about what's going on.
Okay, so I'm just gonna get started because we have about 12 questions and I want to, save enough time to get through them all.
Which I don't know if we are, but
we're gonna try.
Okay.
Because I went through all the questions and these were like the top ones, and I really hope that we can get some answers to some people. Okay, so I think the first question people want to know is like, what's the big change now? Why are people starting to talk about kids? Before, when we first had the first COVID-19, I know we have the Delta variant now. We didn't really focus on the kids as much. And now there's such a focus on the children and what's going on with the kids. So can you explain what the big change is?
Sure. So there has been a significant volume of children in the pediatric emergency room that are positive and or being admitted for COVID-19. Why is this happening? And is it more aggressive? A lot of people want to know, is this more aggressive of a strand? Are we dealing with a different illness than we were originally dealing with? We've been told all this time that it doesn't affect children, and now you're telling us it is. And what I would say to you is there's two things to take into consideration. One, Delta variant is a lot more contagious than the original strand of COVID-19. And we are not all vaccinated as a community. So what is happening is we are finding that there is a larger volume of everyone getting COVID-19, not just children, but obviously adults too. If you live in South Florida, you know. If you don't live in South Florida, or it's not, or you haven't heard about it on the news, Florida's dealing with a huge surge of COVID-19 hospitalizations and people that are getting sick and requiring oxygen supplementation. So in that surge, we are seeing more patients that are coming into the pediatric emergency room with COVID-19. Is the Delta variant more aggressive on children than it is? It's hard to tell, because when you have volume, an increase in volume, you also have increase in morbidity and mortality, meaning like children that are getting more sick from it and children that are dying from it. So what I would say is that personally, from my clinical experience and what I'm seeing and treating in the pediatric emergency room, and we all have different experiences, but my personal clinical experience is that this looks a little bit different than the virus that I had treated earlier than the pandemic. Children are getting more sick from it, especially my age group of 10 to 17. I'm finding that they're coming in. We are not only seeing more COVID pneumonia, which is not like, we're seeing more COVID pneumonia, we're also seeing kids that are having more GI symptoms, are more dehydrated, are just feeling crappier, their fevers are higher, their body aches are worse, and so we are seeing that. I personally am admitting more children to the hospital for COVID-19 for hypoxia, which is your body's ability to oxygenate. So for children that their oxygen levels are low. And I think it's also really important to talk about something that we saw more in the beginning of the pandemic. And it was funny, I was talking to a colleague the other day and I was saying, we're seeing this surge of COVID-19. Where is MISC? And MISC is a post-viral syndrome that we see in children that have COVID-19. It's a full body inflammation. And we were treating a lot of children in the beginning of the pandemic about 3 weeks out of the virus. These children would come in with abdominal pain, vomiting, joint pain, rash, severe headache, and they would have inflammatory markers that would be off the roof, and we'd see inflammation around their heart. And sure enough, my last shift last night, or 2 nights ago, we admitted 2 kids with MISC. So what we're gonna see is that we're going to see children that are not only suffering more with an acute affection of COVID-19, but also children that are having this post-viral syndrome. Why is that a problem? Well, 2 things. I mean, as a parent myself, seeing it, you become more concerned when you see more children that are getting more complications of it. But 2, it puts pressure on the hospital and the ERs, where children that are coming in for all sorts of reasons, because we're not only treating COVID-19, we're having a massive surge of croup, we're having a massive surge of RSV, we're having a massive surge of all sorts of different things, and that require hospitalizations. And gross. We don't like cats. But you know, that becomes, then you start to, your bed shortage becomes more prominent. You know, you have less nursing, more people. The volume then affects your ability to effectively treat and admit patients to the hospital. And that's where I think that it's important to kind of get that education out here. By no means am I on this platform to scare people or to tell people their children are gonna die of COVID-19. Quite the opposite. I'm a frontliner and I'm showing you guys what the trends are so that you can be best prepared of what's moving forward. And in my experience and what I'm seeing over the last month and a half, we had a significant amount of children that are now coming in with active COVID-19 symptoms and or needing hospitalizations. In general, because I don't want people to leave this live and be petrified and scared and worried. In general, most children do very well with COVID-19. They get mild to moderate symptoms that are able to be managed at home. But as a mother, I would want to know and to be informed of the new trends that are occurring. And that might change my management and what I'm willing to do for my child. So I think it's important to keep you guys up to date, to keep you guys informed, and to let you know what I am seeing. It's not to scare anyone, it's to inform people of the trends that I'm seeing.
Okay. So a lot of questions, and so many people ask this, and I know it's so hard for you to answer, but everybody's scared to send their kids to school. They all want to know, should I be keeping them home? And I know this is a very general question, but maybe you can give some
It's the most common question I get.
Common.
People, I feel, contact me and say, my child's 3. Should I be keeping them out of daycare? Should I be keeping them out of preschool? And all I want to do is go through the phone and give them a hug and say, I don't have that answer for you. I really, really don't. What you need to start with, and I tell all parents to start with, is a risk and pro. Like, you need to decide what's going on in your actual neighborhood. What is the caseload? What is going on in your particular area? If you're an area that doesn't have a lot of cases of COVID-19, it's not as worrisome to send your child to preschool. If you are in our situation, it becomes more of like a heightened question in your mind of whether we should be sending our kids that don't need to be in school into school. If your child's kindergarten up, like, you don't have a choice. Right. You're sending your kid to school until that changes, which it might, you guys, but right now you don't have that choice. Mm-hmm. So that's number one. That's the first thing I would say that you want to ask yourself is, what is your area like? What are your needs? Mm-hmm. Are you a working mom? Are you even, is it available to you to not send your child to daycare or preschool? For a lot of us, it's not even an option. They have to go to school. And don't feel bad about that. Like, that is something like we are all dealing with. And if you have to go to school, you send your child to school in the best possible way that they can with the most protection that you can, knowing and understanding that that's what you're doing for your family. Right. What safety precautions are your school putting into play to help eliminate or decrease the spread of COVID-19? And then you ask yourself, who is around me? Who is this going to affect? If you have a 90-year-old woman or that's not vaccinated living in your house, and this is something you want to take into deep consideration. Mm-hmm. What are the people around you? Do you have an aunt? Do you have a grandmother? Do you have a husband that has a complex medical history or something that would make them at increased risk for COVID-19? And all of those things matter. So get out a piece of paper, speak to your loved one, write out the pros and cons, write out like what alternatives you have if you have any, and make the best possible decision for you and your child, and move forward knowing that you're making the decision, an informed decision. And the other thing I would say, just to add, is with anything, like when we go and we pick a school out for our kids, we do all the research. We want to know the teachers. We want to know, you know, the awards that they've gotten. We want to know, is it Montessori? Is it not Montessori? I think that now we're a little fatigued and people aren't taking the time to educate themselves, and not taking the time to educate themselves with resources that are informed and rooted in education. Anyone can tell you that they read a study. Do you know what that means? As a physician, we are taught what it means to be a good study, what it means to be an accurate study, what it means, if the association is a clinical association or if it's not. What is the patient population? What is the error of judgment? All these things matter when you read a study. And I promise you, it's not the headline.
Yeah.
It's not the, oh, well, anyone can cite a study and sound like they're sitting on a platform of authority. But what does that study mean? Be curious, ask questions, do the research, learn the most that you possibly can, and learn from resources that are educated and rooted in that actual field. Like, for instance, do not ask me how to renovate a kitchen, although I could help with the design aspect of it. You know, don't ask me how to code a website. I can't help you with that. If you're asking me about pediatric healthcare and safety, I'm your girl. And you want to do that with any decision that you're making with your children.
Okay. I actually ask this question to Katie all the time. So the kids that are coming in, I know you can't be specific, but the kids that are coming into the hospital, could you give a little bit of examples of like what type of health conditions that they're having? Is there a certain age range, or do they have health conditions that are making it worse for them? You know, what kind of explain what you're seeing?
It's hard because I'm seeing all different sorts of patients. Like, you know, there is no like one size fits all, or I can't tell you that if your child's a perfectly healthy child, that they don't run the risk of having complications of COVID-19. What I would say to you is there are certain medical conditions that make you higher risk, asthma obviously being one of them. What I'm clinically seeing in the last like month or two, and remember, this is a month, these are trends, and that's why it's so important to get ahead of the trends so that you can protect yourself, because you don't want to wait 6 months from now until there's a slew of people in the hospital be like, oh my gosh, I wish I would have listened before. I'm telling you the trends that I'm seeing right now. So what I'm seeing is that older kids, 10 to 17, are getting hit a little bit harder than some of my younger kids, but there are plenty of hospitals that are admitting younger population and saying that the primary population of their admissions is younger kids. But what I'm seeing is older kids, 10 to 17, adolescents, children that tend to be overweight, as a lot of my patients tend to be a little bit overweight or very overweight, and children that have complex medical histories.
Okay.
But again, you don't want to put your child into a pile of like...
You don't know.
And you also don't want to scare yourself in the sense that if your child has asthma, you know, you're sitting there freaking out and you think that, you know, I have plenty of children that have asthma that do fine with COVID-19.
Right.
But if you're talking about increased risk and what we're seeing, I would say that it's medical conditions.
A little bit older. Is it male, female? Is it there a difference?
I have both.
Okay.
And then now to add a layer with MISC, which is what I'm seeing or what I saw in my last shift, that I'm seeing with all different sorts of children.
And I also think that people might not really realize like what could be the long-lasting effects of this. A lot of people say, oh, but flu does this, that, and that, but couldn't this, you know, a kid who gets COVID, couldn't they have long-lasting effects in years from now? We don't know that at this point, right?
Correct, and it's something that you want to consider. So there's been some research out lately, and I think one of my dear friends sends me all the articles in New York Times, and she sent me an article about New York Times that there are long haulers in children, and that they are seeing this massive increase of children that are suffering with long-term symptoms of COVID-19. Another thing that you want to take into consideration,
right?
It's not only is my child going to be hospitalized and need, you know, oxygenation.
Right.
Is my child going to give it to their grandmother? Is my child going to get long-term effects from the COVID-19 virus? These are all things I think we think, especially during this pandemic, very unilaterally. Like it's like a one-track kind of thought process, and we need to start to think a little bit more like globally and macroly about like how it affects the people around us, and how, you know, and how it can affect not just is my child going to be hospitalized, but also what if my child has an asthma attack?
Yeah. My
child has asthma and you're telling me the ERs are packed? Like, how long is my child going to wait for a respiratory treatment? Mm-hmm. You know, my child's vomiting and has dehydration. How long is it going to take to get an IV bag? We need to start thinking as a community and not necessarily as like individuals, and how does this individually affect my child? Obviously, as a parent, that's your number one concern, but as a citizen, we should be thinking about other people. And I think if we could, we would be in a much better place.
Okay, so I heard there are a lot of breakthrough cases. Mm-hmm. If I get vaccinated, is there any certainty that I'm not going to get it? And then why should I get it if there's breakthrough cases?
So there's no certainty in anything that we do in science or in medicine or in life. You're always going to risk. You're always going to weigh in any situation that you address, especially in medicine. What is the risk and what is the reward? Are there breakthrough cases with people that are being vaccinated? Yes, there is. But those people are not being hospitalized. Those people are not requiring oxygenation or supplemental oxygenation, being put on a vent, and most importantly, they're not dying. And if you look at a vaccine and what is the point of a vaccine or why we give vaccines, it's to prevent morbidity and mortality. And that's what that vaccine is doing. So could I get COVID? I'm vaccinated. Like, could I get COVID? Yes, there are some breakthrough cases, although there's a significant decrease in whether you're going to get it or not if you're vaccinated. But could I get COVID? Yes. What is the chance of me being hospitalized and getting really sick from it? Very small. And if you're asking me and my family what that matters, that is the number one most important thing. We are in a pandemic. This virus is dangerous. What are the steps that I can take as a parent and as a, you know, a wife to decrease the risk of COVID-19 to my family, to my sister, to my mother, to my brother, to myself, to my children? And getting vaccinated is 100% the number one way that not only you can protect yourself, but you can protect the people around you.
And I think this kind of answers the next question, which is somebody asked, and we love these questions because I feel like what we're doing is trying to educate and be a platform. And if there's somebody that wants information from us, it's going to maybe help them make a better decision. That's what we want to see. So they're on the fence about getting the vaccine for their 13-year-old, and they want to make the best decision possible. They're not political, and they really just want some extra information to help them make that decision.
The first place I would go to is my pediatrician. Your pediatrician is going to give you the most information that they can in regards to COVID-19 and the vaccine. Excuse me. I have something in my throat.
Just kidding.
So that's the first and foremost. Get educated. There are so many resources out there that explain how the vaccine works and why it is safe for you and your family. And it's important for people. I know there's a ton of fear surrounding around the vaccine. What I would say is, because I see it from the inside out, I'm going to give you a little analogy. I had a patient the other day, a little girl, she had a complex medical history, and she had COVID pneumonia. And she was there with her nurse and the mother and her mother. And I asked them, like, are you vaccinated? Just, you know, not, I don't ever ask in judgment. I just ask, like, you know, just to know whether they're vaccinated or not. And the nurse said, I am, but you aren't. Like, meaning to the mom, like, you aren't. And then, you know, and then she had said, and your mom's not vaccinated and your dad's not vaccinated, and those are the symptoms that they're having, which honestly, I don't feel is like the most effective thing to berate someone when they're, like, to stress somebody out when they're already stressed. But here's the point. When COVID hits, especially when you're in a family that, you know, a lot of people live in one area, it's the grandma, it's the grandpa, it's the mom, it's the dad, it's the child. When it hits everybody. So not only are you as a parent worried about your own health care, but you're worried about your child's health care that's now being hospitalized for hypoxia, for COVID, and you're worried about your mom and your dad. So vaccines are the best, most effective way to help you and your entire family to prevent yourself from getting into that storm of COVID, because it doesn't just hit one person. It doesn't just, I can't tell you how many stories I have of someone that brings their child in to get evaluated, but their mother just passed of COVID, or their uncle just passed of COVID, and now they have exposure. These are the things that we have to think about. educating yourself on the technology of the vaccine makes you feel better. Knowing what the science is makes you feel better. There are so many resources out there that will walk you through, if you're willing to absorb and learn how the vaccine works and why it is safe and why it does not cause infertility and why it does not cause all these things that there's so much misinformation around, is the way to getting to the other side and feeling comfortable with our decisions. Is 100% through education. I always say this, I'll continue to say this on our platform. Education is power. Knowledge is the way to get us through obstacles. Understanding and knowing and wanting to understand and learning about the actual vaccine itself will allow you to get through any fear or obstacle that you might have about getting it. And, one more thing, because vaccines to me are important. The risk, there is always risk that we take no matter what decision we make. You give your child an antibiotic, and let me tell you, every mom in America comes to me and their kid has a sniffle, they want an antibiotic. There is a risk in that antibiotic. That does not come without its set of risks. You can have an allergic anaphylactic reaction to it. You can have a very dangerous skin condition. You can have an immune complex response to it. So the antibiotic itself, although helpful, also comes with a risk. So do vaccines. All vaccines come with a small smidget risk associated with it. And when we see the media, they highlight those risks. But in reality, I can promise you here today on this platform, the risk of getting the COVID-19 vaccine is always going to be less than that of the active infection. If you take the probability of becoming seriously ill from COVID-19 versus the vaccine itself, you will always have a higher chance of having complications. And I'm not even talking about being on a ventilator. I'm talking about long-term effects. I'm talking about nerve pain, chronic fatigue, long hauling, all the different things that you might see, passing it on to a loved one that might then die from it. There's always going to be more risk in the active infection than there is in the vaccine itself.
Good point. This actually goes into our next question. My reservation about getting the vaccine is that it's a new technology involving gene therapy and can alter our DNA, cause infertility. Can you explain this?
Okay. We have a very short period of time, so I'm going to explain it. I'm going to simplify it in a way that makes it that people can understand. First of all, it's not gene therapy. It does not affect our DNA. It doesn't even go into the nucleus where the DNA lives. Actually, DNA makes mRNA. That's what it does. mRNA, messenger RNA, for the most simplest way to explain it, it's a Post-it note. Carrie, you're the DNA. You say, honey, please take out the garbage. You hand it to me. I take it. I take out the garbage, and I throw away the Post-it note. And it's very similar. It's a message to your body to create the spike of the coronavirus, which then your body looks at as foreign and neutralizes it and creates the immune response to fight it off. And the mRNA is gone. It doesn't stay in your body. It doesn't go into your nucleus. It doesn't affect your DNA. Once you have the immune response to it, it neutralizes it and it goes away. And then what does it become? Why do we need it? What is it there for? It becomes basically the simplest way to put it, it's a mugshot. You're on Neighborhood app, and a mom of yours says, this is a creepy guy, don't let him near your kid. It's the same exact thing. It shows the body, here's a protein that we don't like, it's creepy, we don't like it, get rid of it. So when the body's exposed to COVID-19, all of a sudden your body knows what it is and it neutralizes it. And it calls all the soldiers and say, oh, we know about this guy, we heard about him, come on, let's go and get him. And that's how it works. As
compared to if you already don't have the vaccine and your body is exposed to COVID, it's foreign. And it has nothing to fight.
It doesn't have the mugshot. It doesn't know. Right. It doesn't know that your body. It doesn't have the message. It doesn't have the Post-it note. It wasn't educated ahead of time.
Right.
It did not come to our live. It does not understand what to look out for.
Do not come to our live. You should come to our live. Okay, so we get so many questions about masks. We get negative comments about masks.
I would say it's the most polarizing thing that right now in this climate that I'm seeing.
It blows my mind.
It's that a lot of parents and a lot of parents, and I actually just did a recent post on it. You know, it's become this like freedom of choice, this kind of political propaganda or polarizing argument of like, you know, I want to have the ability to make a choice. And so
Okay.
We need to address it. We need to talk about it in order to get to the other reason. And what I would say is, if you are somebody that does not believe in masks, please try to, with anything, just open your mind and listen to what we're saying so that you can try to understand why masks are helpful.
They're helpful, yes. And by no means are you saying that they completely get rid of COVID.
And I think that's important that you say that, because we always get like hateful. As many beautiful comments as we get, we also get a lot of hateful comments. And someone said, you're telling people that if they don't wear a mask, they're 100% die. I would never say that. That is not what I'm saying. That is not the message that I am preaching. What I am saying is that a mask paired with other things is layers of protection for not only your child, but the community. It's like when you get into a car to drive on the highway with your child. You're not going without a car seat, without a seatbelt, right? We have
airbags, without like everything around you.
There are several layers of protection in your car to help you, God forbid you were to get in a car accident. You have airbags, you have a seatbelt, you have a car seat, you have rear view mirrors, you have, like, you know, some people, my car like vibrates if you go a little bit too far to the left or the right. You know, these are all things that protect us and our family as we drive on a busy, dangerous highway. It's the same concept. By no means am I saying if you put your child on a mask, you're good to go, you're not going to get COVID, your kid's not going to get COVID, their grandmother's not going to get COVID. That is not what I'm saying. What I'm saying is that it is a significant, outside of the vaccine, I would say that it's the second most effective way and preventative measure to help our children and to help the spread of COVID-19 amongst children in schools. And let's explain.
Well, the question really is, a lot of people bring this up about the flu season. Like, we don't wear masks during flu season. Why are we wearing them now? Like, why do they work? Well, what's the difference between a year ago when we had a terrible, 2 years ago when we had a terrible flu season, and now?
Okay, so one huge underlying difference. The flu did not lead to millions and millions of deaths. People always say that we lost more people from flu season, like from the flu, than COVID-19. I don't know where you're trying to pull this information. That is absolutely not true. And, you know, a child easily transmits this virus to other people, which then suffer and can die from COVID-19 in an adult. So that is why we started wearing masks.
To help the person next to you.
To help the person next to you. Because the mask itself prevents, if Carrie has COVID and she's talking to me, it's not a 100% barrier unless you're wearing an N95, but it prevents her from giving it to me.
Right.
Now, a lot of parents are like, I don't care about that. But that's where we're missing the boat. You should care.
You should care.
You should care, because you want that person to care about you if their child has COVID-19. So the mask prevents, in order to understand how the masks work, you have to understand how COVID is transmitted. It is not only through aerosol. There are multiple modes of transmission. It is transmitted through aerosol, and that is less effective when you're using an actual cloth mask or a surgical mask. There is some protection, as I said. When somebody has COVID-19, it prevents them from, you know, emitting it out to the rest. Some, not all. I'm not going to get into argument with people. There is some protection in that particular capacity. But here's how it also significantly helps. There are respiratory droplets. When you cough, when you sneeze, when you talk, when you laugh, that fly out of your mouth when we're doing these things. Those droplets then go out into the air. They can go into your face. They can go into your eye. If I'm somebody that's not wearing a mask and I cough, you're immediately, a piece of my respiratory droplet is going to hit your face, and then all of a sudden you are going to be exposed to COVID-19 or any virus for that matter. The mask helps prevent those respiratory droplets from being transmitted, not only from the person that is emitting them, but also from the person that's wearing a mask and receiving them. So there is protection in respiratory droplets. Also, respiratory droplets go out. They go, and this is how a lot of influenza, adenovirus, this is where we get the transmission, especially in school. So to understand this, like, you have to open your mind to understand that this is why we get viruses transmitted throughout school. They emit it, it goes onto a surface, a desk, a toy, a book. And then your child picks up that toy and they play with it, and then they touch their face, and then they give themselves whatever the virus was that was on that particle. Masks, children, what do children do? What are the nature of our children? They play, they yell, they scream, they touch things, they put everything into their mouth,
especially
the young ones, especially the toddlers.
Yeah.
So when you have a mask, a child on average touches their face, an adult and a child, touches their face an average of 17 to 23 times in an hour. So the mask then becomes protective, not only against COVID-19, but amongst other viruses that we see commonly during the different seasons. And that's how it works, people. It works in conjunction with other measures to prevent the spread of COVID-19.
Okay. I think we have time for one more. I think we're almost at our limit here, but I know you probably can't answer this, but so many people ask this. When do you think a vaccine will be available for kids under 12?
Oh my gosh, I wish I knew. I really do.
I'm
thinking,
soon.
I mean, I actually, to be honest with you, thought that we would have a vaccine at this point. I thought they would really try to push the vaccine out in order to like get kids vaccinated before school. We want to make sure that we have the right research. And this is also a testament to the process and to the safety of your children and the vaccine. They wanted to collect, I believe, and I don't want to spread misinformation, but 6 months of data of how the vaccine worked from the 12 and up.
Yeah.
And we are almost about there. I think it's like I think it's August. So what I'm hoping for and anticipating is that maybe we will have a rollout in October.
Okay.
Fingers crossed. But again, that's just my thought. There's no proof to the, like, I don't have a resource in the CDC. I have no idea. But that's just what I'm hoping.
Somebody actually asked a question, and I did have this, so I want to try to answer this. This is about the antibodies. And also maybe the difference between somebody who had COVID and has natural antibodies, and then those that are vaccinated and have antibodies. Like, for example, you were vaccinated back in December. Like, now, maybe if you went to get an antibody test, it wouldn't show up that you had antibodies, but are you protected? Like, what's the difference between that and then somebody else who had COVID and has natural antibodies? Like, kind of explain that.
Okay, so there's different types of immunity. There's your natural immunity, and there's an immunity that you get back from vaccines, and some people actually have both, which is wonderful.
Which is great. Because they're recommending, if you had COVID, to get the vaccine too.
Correct.
Okay.
Correct, which we can kind of address. You might not actually have antibodies in your body when you actually take that lab test. So if they actually drew blood from me right now, I might not have antibodies. I probably wouldn't have antibodies. It's been 6 to 8 months.
Yeah.
However, we don't know, and what we do have in our body are memory cells and T cells. And what we hope is that when we, as I mentioned before, that mugshot of COVID coming in and your body saying, oh my gosh, what is that? They have a memory cell that allows them to say, wait a minute, I've seen this before. Let me produce antibodies and let's fight this. So you do have protection against COVID-19 if you get vaccinated and you don't have a blood test that shows that you have antibodies. Okay. So, but what we're trying to do with the booster shot is prime your system again. Basically reintroduce your system to it so that we are even stronger and even better with it.
It's like a new variant.
With what we are seeing clinically is even with people that got the vaccine in January, people that are getting breakthrough cases are not getting severely ill and requiring oxygenation. So, and supplement and admission.
It's working.
So even though you are having an exposure and maybe even having a breakthrough case of it, you're not getting very, very ill from it and requiring hospitalization. So yes, clinically, if you look at it scientifically and clinically, the vaccines are helping to protect our community against COVID-19.
Okay.
The people that are getting very sick from the Delta variant, you guys, is people that are the population that are unvaccinated, the younger population between 20 and 40 years old. That's what we're seeing in the hospitals right now, a huge surge of younger people that are unvaccinated that are getting sick from COVID-19.
Is there a huge difference between natural antibodies and vaccine antibodies, or is that?
So the only thing I could tell you about that is that they did some research and they said that if you had COVID-19 and you got vaccinated, that you're about half as likely to get COVID-19 again if you just had the actual natural immunity.
Right.
And natural immunity, like, people say, oh, well, if I got it, I can't get vaccinated. And that's absolutely not true. So people even will say to me, like, oh, you shouldn't get vaccinated for 3 months, which also is not 100% true. What they're saying is in those 3 months, you have a pretty strong natural immunity to it because you have so many antibodies, because your body was just exposed to it. So getting the vaccine in those 3 months, although you absolutely can get the vaccine after you have symptoms, it's not as necessary as if after those 3 months.
Right.
The only time you cannot get the vaccine when you have an active COVID-19 infection is, first of all, during that time that you're symptomatic. You have to have a certain amount of days after the actual virus itself to get the vaccine. But also if you got antibodies, like if you got the monoclonal antibodies, then you do have to wait. Which is a treatment? Which is a treatment for the actual virus itself, and it's a treatment that we usually give to children or to adults that have a pre-existing medical condition, that are immune compromised and all that kind of stuff. Okay. So if you got that, then there is some restriction to when you get the vaccine.
Okay.
Now, somebody that is naturally immune compromised might not mount the same response and not be able to hold, the immune response the same way someone like I would or you would. And therefore, that's why those boosters rolled out for the immune compromised. We are going to start getting boosters for frontliners and the population, which I think is wonderful. It's a gift. Get the booster if you had it.
Yeah.
And, just stay safe and healthy. Do everything you can to keep yourself safe and healthy and your family safe and healthy.
And also, a quick thing, because we have a post today, I just wanted to thank all the teachers and everybody out there in the schools that are going in there. We have so many cases in South Florida, and I just, major applause to everybody there.
They are the true heroes. They are putting themselves on the line. They are managing their own anxiety with the anxiety of our children, their mental, their emotional, their physical, their academic health. Like, we so much admire you. We love all of our teachers, and thank you so much for all that you guys do.
And if you guys found this helpful, if you have any more questions, please DM us. We can do this again once we get another influx of questions. And please share this if you feel it was, you got a lot of good information.
Yes, education is power. We have to fight misinformation with information. Mm-hmm. So, if this was helpful for you, if you got a question answered, if you know there's a friend that has a similar question or has similar concerns, share it. That's what we're here to do. We want to get the information out. So, so please feel free to share.
Thanks, guys. Thanks for joining. Bye.